a show and tell room as part of lab this week. So we've set up this room just because of social distancing. We're using 3 different labs. So I wanted a place for you all to be able to come and look at different wounds that we'll see in the hospital. Lay your hands on some of the different drainage devices that we talked about today in lecture, and then look at some of our nursing interventions that we can implement. And we're going to talk about some of those things today, and I just wanted you to be able to see those. So part of your lab this week, you're going to be able to come to this room, A035, and put your hands on all this stuff. You're just going to walk around, socially distance yourselves, and just look at them. Okay, so the first thing we have, we're going to have a station with all the different wounds we have. So what I love about these is on these, so this one is a booty mannequin, and so you can look at him, and we even have this handout. So you're looking at different wounds on him and different issues, and you're like, oh my gosh, what is that right there? Well, you just come over to this handout and it points to it and it tells you that is some eschar tissue that he has going on, okay? I can even turn him to the side and he has a stage 3 pressure ulcer on the side, okay? Here in the middle, if I wasn't sure how that was staged, if I didn't remember, I could look. But the best thing is to come in for you to look and try to stage them. Remember, we're not going to be staging in the hospital, but it's important for you to understand the stages. So this one has a little bit of bone showing too, and some tunneling you can look at going underneath the skin. And so that's a stage 4. Okay, he also has a yeast infection. We see here, this is a little bit, it'll tell you this, a little bit of herpes. And so he just has a ton of different wounds that you can come and look at and see exactly what they are, okay? So moving over to our other side, again, just different wounds, okay? So we have a foot here. So you have a toe that is necrotic, and also we talked about suspected deep tissue injuries. This is a great example here of that big bruise, and if you're to touch it, you see that it's nice and mushy. Okay, so that's probably gonna open up and be a stage 3 or stage 4 pressure ulcer. And so again, different wounds. Remember this summer we were big on inspect the heels, inspect the heels. Here you see why. Okay, so he has wounds all over that foot, and you can just use the diagram and look at the number to determine what type of wound it is. Back to patho from this summer, wound healing, like Miss Kennedy did a refresher on today. Your inflammatory phase is here, your collagen building phase, and then remodeling, and it tells you the day. So that just gives you an example of the patho of skin healing. And again, just more wounds. This one's really good. It walks step by step into the deep tissue injury, eschar when you open it up, and then as it heals, and then you'll see different wounds there. Another one that I like to show you is this sacral wound we have. This one has the different stages too. You have a stage 1 here, a stage 2 on the side, a stage 3, and a stage 4. And what's really cool about this one is you can really see the tunneling. Okay, when we're doing dressing changes this week, you might have some tunneling, and we've got to take our cotton tip applicator and really get the gauze underneath all of that tunneling in the wound. So that's why these are really great to look at. All right, next we're gonna move over to our other station, which is right down here. And it's just some of our different drainage devices that y'all talked about today. So it'll get you have the knowledge, and now you get to come in and you get to play with them. So these here, if you can see those, are your different types of drainage, just a real life example. So these are these are called ABD pads. So this wound would be on my patients, for example, if it's their abdomen, okay, I would remove it and I have to assess it. So remember in lecture, y'all talked about serous, sanguinous, and then serous sanguinous. So that just gives you a real life example of what those would look like on a dressing. So you can come in and just kind of remind yourself what each of these are called, okay? The next one we have here is our Penrose drain. So this is one that we usually are going to use for abscesses a patient may have. And you see they come in different sizes. There's little bitty ones, and there's great big ones. Okay, and they're just placed if a patient has an abscess, the surgeon will place it, and it's gonna help provide a way for that exudate to drain out, okay? So this one drains by gravity. It's just left laying there. So you have to be very mindful. You're gonna have this Penrose drain, and it's going to have just gauze at the end that is absorbing anything coming out, okay? So you have to be mindful that it's not dripping on the skin and gonna cause skin breakdown, and you just are gonna go in and change those dressings or reinforce those dressings, okay? It does have a safety pin on it, and that safety pin just allows you to know the location of the Penrose. Okay, so I know right now the safety pin is at the mark of the incision. If I come in 2 hours to reassess my client's abdomen and I note that the safety pin is way down here, okay, it lets me know that this drain has been pulled out just a little bit. Okay, so I would want to make someone aware that it has come out some. Next, we have the wound vac, and you'll see we actually have this set up and running, so you'll be able to look at it. And this is one like a patient would go home on. So remember Miss Kennedy talked about these patients usually have these long term. It's an incision or a wound we just can't get to heal properly. And so this is a home wound vac. So the patient just simply turns it on, and the doctor would give them orders. Does it need to be 125 millimeters of mercury suction or 75 millimeters of mercury suction? This one is set on 75, so you see it's lit up, okay? And then on the back of it, you have your drainage container. So again, this is a home one, so it's not easy to measure the output. It is on the side where you can see, I don't want to break it down, but you can see there's measurements, okay? The ones in the hospital are a little bit bigger, and it's easier to see the measuring container for us to record our patient's output. All right, the next drain you talked about that you will see is a HemoVac. Okay, so this is a mastectomy setup. This patient has a HemoVac coming out of one side and a Jackson Pratt or JP drain coming out of the other side. So with this HemoVac, all it does is it compresses, and it's slowly using vacuum from that compression to pull out drainage, okay? So if I was gonna go in my patient's room and empty this, I would have gloves on, okay guys? Make sure, remember I don't wanna touch this without gloves. I'm gonna open it gently. You don't wanna spew out any drainage, okay? And then I would have my specimen cup, and I would empty it. Okay, just for the purpose of the video, I'm not going to completely empty it, but I would empty it until there's nothing left. To recompress it, I just gently compress my container and close it, okay? Then you see it's closed, so that means it's actively pulling. Okay, if I go in and my container is open or it's not compressed, that means it is not working. It's not going to be pulling that suction. Okay, I would then measure and see how much output I had. And I have about 40 milliliters or 40 cc's. I would document that as output under that drain in Epic. Okay, I also have to document the color, the consistency, if it has any odor. I would need to make sure to document that too. All right, the other one is the Jackson Pratt drain. It works very similarly, okay? It has a tube and a bulb on it. How it works is that bulb has to be compressed, okay? She showed you that in lecture today. So if I was gonna empty this, I would just open my bulb with gloves on, empty out this little bit of drainage, okay? And then to compress the bulb, I just squeeze it back and re-close it. You see it's compressed now, so that means it's actively using suction, vacuum to suck it out, okay? If you ever go in and the bulb is not compressed, if it looks like that, there's no sucking going on, okay? No suction, so it's not doing its job. So you would want to re-compress it and close it back to make sure that it's working properly. Okay, so when you come to lab, y'all can practice laying hands on it, playing with it, opening it, squeezing it back, closing it, just to get familiar with what these drains are and how they work, okay? The next station we talked about some nursing interventions and preventing complications with our patients' wounds. So this first one is an abdominal binder. So today we talked about dehiscence, evisceration, splinting. This is a device used for splinting, okay? If I have a patient that has an abdominal surgery, I can put this around them and wrap it tightly, and it sits around their waist and helps splint where we don't overexert those abdominal muscles, okay? Sometimes we talked about restraints in our safety lecture. Sometimes we'll get these if we have a patient that has a peg tube in their belly and they're confused or disoriented and they keep trying to pull it out. We'll even get one of these and loosely place it around the patient's abdomen to cover that peg tube. Now, of course, we're not going to obstruct it or cause any issues with the peg tube, but it just acts as a cover, and that would be at least, an alternative to a restraint. So we get creative sometimes. So that's an abdominal binder. The next thing we have for you to look at are some really cool devices or dressings we use called Mepilex dressings. Okay, so a nurse many years ago now probably created these, and she had worked with patients with wounds and tried to figure out a way to prevent pressure ulcers. She developed this. I'm sure now she lives on some nice fancy island somewhere, sipping her nice little drink on the beach, okay, because she made a lot of money. These are fabulous, okay? So you'll see they come in different shapes and sizes. Okay, I have long ones, rectangular ones, I have square ones, and this one is actually for the sacral area. Okay, so what they are is if you have a patient that's high risk, or they even have a little bit of area that won't blanch for you, we can get a Mepilex dressing and place over it. So if I have an elderly client, like we talked about Mr. Johns in the case study today, if I had Mr. Johns on his coccyx, I would take this dressing and apply it to his sacrum. Okay, you see it's the shape of it. These dressings are good for 7 days. So when you're assessing your patient, you see them, they'll be timed and dated with the nurse's initials of when it was applied. Now, the key to these dressings, you must remember to assess under them. So if my patient has this in place, okay, we'll just use the hip, okay? If they have it in place and I go in to assess, I am responsible for peeling it back, assessing the skin under it, and then I can reapply it. That's the cool thing about it, okay? I can reapply it. It will be good for 7 days, all right? So y'all are gonna get to come in here and feel these, and you can even kind of pull it off and see how it re-sticks and feel the middle of the pad that helps with pressure ulcer prevention, okay? The last thing of the video that I want to show you is the fun part that you're going to get to do in your stations, okay? Students get really excited about this. We have suture removal and staple removal, okay? So you're going to have one of these in your station that has staples on it and sutures. So we have enough for all of our friends. You're all going to get a chance to take out like 2 or 3 of each. Okay, so for my staples, I have a staple removal kit that comes with these fun looking staple removal scissors. I would want gloves on, okay? It has a piece on it, and we'll show you all this in lab when you get to practice, that I am just simply going to go under the staple, close my scissors, and it removes the staple. Sit it to the side. Go to my next one, put it under it. It's harder on a mannequin. Let me do this one. Squeeze, and it removes it. Okay, the key is I need to keep count of those and make sure I dispose of them properly. Okay, for the suture removal, I have like a pair of tweezers and scissors. So all I do, we're gonna see if they have a good suture for us to remove, is pick it up with the tweezers, go under the suture, clip it, and pull it out with my tweezers. Okay, I just wanna make sure I get that full and keep count of it. Okay, again, I'm just pulling up my knot, sticking my scissors under it, and pulling out my suture. Okay, so y'all will get hands-on practice with that in your stations this week. So this is the show and tell room. This is what we have. So make sure you come by here and you get some hands-on practice and look at. This is gonna help nail in some of that information you got today and help you guys in practice and on your content test this week. Thanks, guys.